right? So if it was, okay, well, it turns out my dog didn't get enough rest, or I tried a new food and it upset their stomach and that threw them off, or, whatever it happened to be, okay, well, I'll know to do this now differently in the future.
Yeah.
But if I'm in this mindset of like, no, 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 I'm doing everything right, and I don't have that kind of critical self-examination
Mm-hmm.
of my own behavior and how that could then impact my animal, then you're likely to just keep having those kinds of problems.
Right. What is your, because I have another question that popped into my head, but before I ask that or get into that, what is your definition of belief? I know an older definition from the Oxford Dictionary states that a belief is the acceptance that something exists or is true, especially one without any proof. And then the Merriam-Webster's, I'm going off memory here, I believe it was the acceptance that something is exists or is something like which we judge to be true. And so, like, what's your definition of belief?
Yeah. So I think it depends on what kind of belief you're talking about, right?
Okay.
So when I talk about beliefs, generally what we're talking about is, here's something that I think is true, right? And that I then act as if it is true.
Ooh, that's good.
Because our actions come from our, right? I don't just act without any sort of reason for it, unless it's like a reflexive sort of action, right?
Mm-hmm.
And so beliefs to me are those things that we think and feel as are true and accurate, that then drive our behavior. And those are the ones that I'm really interested in, the ones that drive that behavior, right?
Same here.
Because maybe I believe that, I don't know, Bigfoot is a trans-dimensional traveling alien, but it has no impact on my behavior. Well, then who cares if I believe that, right?
Right.
If I have a belief that Bigfoot's a trans-dimensional alien, and therefore I have to, keep everyone out of all forests everywhere, and I start shooting people to keep them out of the forest in case Bigfoot shows up, then I'm concerned about that belief, right? So for me, it's that, that belief is what's driving our behaviors. And there's different kinds of beliefs, right? You can have a poorly justified belief or a well-justified belief. And when we have those well-justified beliefs, that's where we have empirical evidence and logical support for them. Poorly justified beliefs are those ones where, well, I believe it because someone told me, or, well, that's just how I feel, or I'm basing it off of my small amount of experience with, a particular group or a particular, kind of exposure to the world. But I may not have enough exposure, right, and enough of a sample size to be able to say, oh, this is how this or that is in reality.
Yeah.
And so those well-justified beliefs, that's what I, am encouraging people, and I try to help people develop. And that means you have to start by examining your beliefs to see, are they well-justified or not?
Mm-hmm.
And that can be beliefs about, yourself. That can be beliefs about the people around you. That can be beliefs about politics, religion, whatever it happens to be. Mm-hmm. Can I justify that? And kind of like what we were talking earlier, those people who have well-justified beliefs don't have problems telling you about them and defending them, right? Because they are well-justified. And it's those folks who haven't examined them, don't have well-justified beliefs. That's where you start running into people getting so defensive and angry, and they end up saying things like, well, let's just agree to disagree, which is a terrible phrase, right? Because what you're really saying is, I'm tired of talking about this, let's stop.
Yeah.
Instead of, no, let's actually hash this out and see which belief is more well-justified, right? Number one, number two, where's the evidence lie, right? Like if I think that, we need to build a wall at the southern border and you don't, okay, well, let's just go our own way about it. No, let's actually take a minute and let's look at the evidence to support, is this going to accomplish a certain action or is it not? As opposed to just the, I think, thing that happens all too often nowadays, which is, well, screw you, right? And we just walk away.
Uh-huh. I see
So,
that a lot in the police world.
yeah. In terms of the trainers and
Yeah, the trainers, the handlers. Yeah.
yeah,
I hear that all the time. You know, they'll go back and forth for a little bit, trash talking each other, but eventually they get to the point where, okay, fine, we're just not going to see eye to eye. And there's a lot of, I don't want to say, let me rephrase. I don't want to say a lot and give the belief that it is thousands of people. No, it's not. There's a lot of good canine handlers out there and trainers that are like, hey, look, I'm open to having this discussion in a respectful, caring manner. I don't need to throw you under the bus, but I do want to talk about this. Let's discuss it. There are a lot of good trainers and handlers that want to do that, but you do have your few that do exactly what you're just describing.
yeah.
So I was really happy to bring that up.
Yeah, and I think that's where there's a big difference between a scientific mindset and a non-scientific mindset, right?
Mm-hmm.
So if I am arguing with another clinical psychologist about what the most effective method to treat, let's say, PTSD is, we don't just argue and argue and argue and then finally be like, screw you, right? It's okay. Well, let's set up some clinical trials to test this, right? Let's set up some experiments to see which works better, yours or mine.
Mm-hmm.
And that's, I think, all too often missing from enormous swaths of working with animals, whether you're talking about dogs, horses, livestock, where people just develop these beliefs and then they just run with them forever, right? As opposed to, you know what, let's do a controlled test of this. Let's see if your method or my method is better. Right. And let's do so in a non-biased way so that we remove, the potential for, well, I think I made this, so therefore, of course, I'm thinking it's better.
Right.
Let's put these things head to head and test them in such a way that we can actually determine, is this or that better? And that's the scientific mindset, right? Because, I don't just want to argue for the next 50 years about this.
Mm-hmm.
And then I die. It's like, well, I'd rather know, am I right or not? And if I'm not right, you know what? I'd like to know that now so that I can change and correct, as opposed to just, moving forward ahead with my life and ignoring everything.
Right.
But that is that scientific mindset. That's a critical thinking mindset. And it's not a natural mindset for people.
Yeah. Well, and as an educator, I'm happy that you do have that mindset because, man, if you got stuck on one thing, then you're passing that wrong information down, and you're going to be biased for that. And people are going to be like, well, Dr. Lack said. So,
Right.
So I think for me, that's where I want to be. And I'm really glad that, people have the mindset like you have. And I'm glad I obtained that mindset too. Because number one, I don't like to be wrong. For me, it's an integrity thing. And like you said, look, if I don't know, I don't know. Or I can say, well, this is what I think based on this research, but is it possible that I didn't read the research right? So I've learned how to say the way I see it from this piece of research that has to do with dogs and how they think or the behavior side or the belief side, whatever. This is how I interpret it. And then hopefully it creates a discussion and I don't get thrown under the bus. But I really feel like there's quite a few people that really lack that ability to kind of be humble in that. And I think that's one of the biggest things that I'm seeing as you talk to me about your mindset and how other researchers are. There has to be a sense of humility in there in order for you to grow and become smarter than what you were yesterday.
Yeah. So we actually talk about that specifically in class in that term humility, because if you have this idea that, well, I'm right about everything and there's no way that I could be wrong, then there's no way that you will actually accept any kind of information showing you are wrong, right? And so whether that's being humble about the limits of your knowledge, right? So like I'm, for example, not a microbiologist. So when my best friend that's a microbiologist talks about microbiology, I don't step in and go, really? I don't know. I think of this, right? So I recognize the limits of my own knowledge and that means I recognize my ignorance, right? I recognize where I don't know things. And I recognize that I'm not ever going to be able to know everything. And if I act like I do, then, that people are going to be able to tell that, right?
Yeah.
And they're going to be able to tell that you're just pretending.
Yeah.
And it's much more epistemologically sound for me to recognize my humility, right? So I know what I don't know, right? And I'm aware that there's so much that I don't know.
Yeah.
And that lets me then develop that kind of learning mindset of, okay, well, teach me, right? But only teach me if you actually have evidence to back it up, right? If you've got some good empirical support, logical reasons behind it, not just your own ideas, and that's it.
And I do have one final question for you, and I know how busy you are, and we've been going almost an hour now, which is awesome. I can't tell you how much I appreciate the information that you're bringing to these guys and gals that are helping protect our communities. But you hit on something earlier, and then my brain went somewhere else because I was going to ask you about this before. But what I find interesting is how you said that beliefs create action or behavior. And I started thinking about how the beliefs of other people create a behavior that then creates a belief in me. For example, if like men, for example, I think this is a good analogy. Men really desire respect over like unconditional love. They need both, but respect is more important subconsciously. And then for women, it's the opposite. So if a woman looks at you with a disgusted look on her face, we interpreted that as, well, what I just said, she didn't approve, or what I did disgusted her. And then, so if we see that repetitiously over and over and over again, eventually you get into a different relationship, and maybe that person gave you that disgusted look because they were tired. They didn't even intend, they had no intention of disrespecting you, but because of your repetitious past experiences created that belief, and now you're going to behave as you believe, but then that's going to create a belief in them that, holy crap, first thing in the morning, this guy's an ass.
Right. Right. Yeah. And that's a very good example, I would say, of one of the things that we call a self-fulfilling prophecy, right? Which is I hold a certain belief, which makes me act in a certain way, which then just confirms said belief. Right?
Ooh, yeah.
So if I'll give you an example related to dogs, right? So if I think that all dogs are scary and terrifying and they just want to rip my throat out, right? And then I'm approached by a dog and I act in a way that indicates I am scared, worried, think they're going to rip my throat out. And then the dog, maybe has a like, oh, what's going on? Or maybe they smile, right? And you interpret that as, they're baring their teeth, right? And then you run away and you leave. You think back and you're like, I knew it. I knew they were vicious beasts that all wanted to kill me, right? When in reality, maybe it was just saying hello, and it had just finished running. So its mouth drops open, right? And you can see its teeth because it's panting. But your belief is driving that interpretation of it, right?
Ooh, interesting.
And so you and I can see the exact same stimuli and come away from it with a very different understanding.
Mm-hmm.
So one of the things that I work with people all the time on are fears and phobias. So in my office at the university, I have a ball python. He's about 5 feet long. He just lives in an aquarium there. And I use him to demonstrate to people how to cure phobias, right? And so he's about 19 years old, has never bit anybody, right? And he's older than my freshman, right, in college. He's never bit anybody, which most of them can't say. But if I bring him into class, guarantee it's the exact same stimuli, same snake. Some people are going to respond to that like, oh, that's cool. And some people are going to be like, hell no, I'm getting out of here, right? I just wet myself. I've got to leave, right? This is terrifying. And what is it that's driving it? Because it's the same stimulus, right? It's your interpretation and your beliefs. If I believe all snakes are dangerous, if I believe all people who look like this act this way, right? If I believe that dogs of this breed are particularly this or that kind of way, then I'm going to find the evidence to support that belief, right?
Mm-hmm.
Back to that confirmation bias. Because those beliefs drive how we interpret the world around us, and they drive what we then do in response to it. And so we have to examine those things, those potential biases and those beliefs that we have that could then impact our daily work as, let's say, a police officer, right? As a professor, as an educator, as, a health professional. And if you don't examine those potential biases that you have, then you're very, very prone to just continuing on in the same way, maybe not with good evidence.
Mm-hmm. One question that I have for you, another one. I keep coming up with questions for you. You're making my brain go 500 miles an hour.
All right.
You talked about the ball python. Do you believe that the best remedy for fears and phobias and other psychological disorders is exposure over medications and stuff like that?
Yeah. So for our fear and anxiety-based problems, our gold standard treatment is behavioral therapy and cognitive behavioral therapy that focuses on exposure with response prevention. And that's really should be our first line treatment. Certainly not everybody responds as well as we would like, which is where you then start seeing maybe medications come in, potentially other kinds of supplemental therapies, even like non-invasive brain stimulation and things like that. But exposure and response prevention, which is a kind of cognitive behavioral therapy, really is that first line treatment because it works so well, it has no side effects, and it maintains. So you don't have to go to therapy forever, right? Yeah. You go to therapy, you learn those skills, you change your behavior, and then you stop going to therapy and your progress continues, which is unfortunately not what we see with things like medication usually. I stop taking it, it stops working.
Right. So this is my interpretation of exposure. I believe, and I could be wrong, and I'm okay with being wrong, so maybe you can direct there. But I believe it's a way, I believe that based on what I'm learning so far in psychology, that when you have repetition of thought, it creates the belief in some cases. I know some beliefs just happen instantaneously. I get that, and I understand there's different categories of belief, as you said earlier. But I believe certain things is repetition of thought. Well, the last time there was a snake present, it just scared the poop out of me. I watched a YouTube video where a guy got bit by a python, and then they kind of repeat that experience and feeling that sensation of fear and the chemical reactions and the cortisol and the adrenaline and all that other stuff. When you do the exposure, I feel like it's each time the person becomes more consciously aware. It's almost like, okay, I've been around this snake 5 times. Nothing bad has happened so far. So it's almost like the more you do it, the more the person or even the dog comes to the realization that I've done this 100 times and nothing bad did happen. So then you begin to get consciousness.
Yeah, so that's, the big thing with exposure and response prevention is that for things that people are afraid of, they have the exposure to it all the time, right? But then they're acting in a way that confirms their beliefs, right? So I see a snake, right? And I'm afraid of snakes, and I go, oh, no, and then I run away, and I feel better, right? Because I'm no longer around that. I think I knew that snake was dangerous, right? Because I feel better because I'm away from it.
Yeah.
What we do in exposure therapy is we expose you to that same stimuli, and then we work on preventing that natural anxiety-based response so that you have a chance to do like you said, which is I have a chance to see I was wrong.
Yeah.
Right? I'm putting myself in a situation and staying in it to prove that my anxiety is lying to me. My fear is lying to me. And when we do that over and over again, you start shifting those beliefs that you hold about that particular kind of stimuli, a snake, heights, whatever it happens to be. And you start readjusting it back to normal. So Are some snakes dangerous? Yeah. Are some dogs dangerous? Yeah. Are some people dangerous? Yeah. But are all snakes dangerous? No. Are all dogs dangerous? No. Are all people dangerous? No, of course not. And so it's all about really shifting that cognitive structure or your schemas about those things back to a normal baseline.
Yep.
I'm not trying to make someone completely without fear, right? Because it turns out fear is one of those big things that helps keep us alive.
Sure.
But I want it to be a normal level of fear where I can go use the bathroom in a public restaurant, right? Without worrying that I'm going to catch some sort of disease, unless I wash my hands for 30 minutes or something, right? So that exposure process is all about correcting those false beliefs that have been developed and then maintained through a lot of the ways that we talked about earlier, and just shifting them back to normal.
Right. Well, and that's, talking to you has really made me think about my research paper that I did when I was going to Purdue. My hypothesis was to determine whether the human belief system alone has more of a negative impact on dog behavior compared to a positive. So first I looked statistically, okay, what's the population of the United States? So I figured that out. Then how many dogs live in American homes out of the overall population? And of course that number is still not accurate because there's some unregistered dogs. But we got a pretty good number. And then, okay, so out of the entire population, how many are dealing with an abnormal psychological disorder? Your fears, your phobias, your anxieties, all that other stuff. And it turns out the majority of people in the United States are dealing with these psychological disorders, and it's due to like economy, social media, the news, spreading.
Yeah. We've got about 30% of our population here in the U.S. would qualify at some point in their life for an anxiety-based diagnosis. Yeah.
Yeah. See, now that figure is a little bit lower than what I got from my paper, but I'm glad you said that because it could have been I looked at something that was a little flawed. But either way, what we do know is that there is a high rate of dogs. I mean, when you're talking 30% out of a crap ton of people, that's actually a pretty large number. And then you got to figure out how many dogs live in those homes. That's a lot of dogs with, these that are feeding on their owner's belief of a lot of times what's creating the fear. And I've seen this multiple times where somebody would get a dog, they'd come to me when I had my kennels and they would say, well, my dog is dealing with social anxiety. It doesn't like to be around people. And I would say, okay, when you got the dog, did you get it as a puppy? Well, no, we rescued it. Okay. So did the dog have social anxiety when you first got the dog? No, we thought this dog was good to go. He was great. And I said, okay, does anybody in the home deal with social anxiety? Like who's around the dog the most? Well, my wife is. Okay. How does she feel when she's around a group of people? Well, she doesn't like crowds and she doesn't like groups. So I wanted to know, is it possible that the dog learned to be fearful of crowds through trial and error by being around mom? The answer is yes.
Oh yeah. One of my favorite examples that I use to talk about things like that is the story of Clever Hans. Do you know Clever Hans?
I do, yeah. But explain to our viewers.
Yeah. So Clever Hans was a horse that lived in the early part of the 1900s in Germany. And his owner claimed that Hans could do these like incredible mathematic feats, right? So they would ask him in English, or I'm sorry, in German, they would ask him a question, a mathematics question. Hans, what is 7 times 6, right? And then he would start stomping his foot. And then when he got to the right number, he'd stop. It was like, what the heck? This horse is doing math, right? And, it became very famous and he was like touring around. But there were some people who were very skeptical of that, as they should be, because horses not known for their high math abilities, right? And what they found through very careful, controlled trials was that Hans would always give you the right answer to math as long as you knew the answer. Mm-hmm. Because what he was doing was this horse was simply responding to and had been conditioned to stop when he got certain cues from the people around him, right? So I'm at 40, no, 41, 42. People are like, oh, I better stop, right? And then he gets praised and reinforced for that. But as soon as you just whisper it in his ear, right, where no one else can hear you, then the horse just kind of stands there like, what's going on? And all animals are like that, right? Humans included, right? We are conditioned by the environment around us. And so if I've got a dog that is picking up on cues from me about what to be afraid of and not be afraid of, right? What to bark at and be loud at versus not, who's safe, who's not, then yeah, of course your dog's going to respond to those things because they're taking their cues from you, right? They're learning from you, just like our children learn from us. Same sort of thing.
Well, and I think that people also need to understand that a lot of times our behavior or our body language is subconscious. So in a lot of cases, so you're not really consciously aware that you're actually behaving in a specific way that is actually teaching the dog a thing or two about the environment that it's in. So, and that's why I said, listen, training is not just this regimented sit down, stay. It's literally how you behave around the dog. But then I wanted people to understand that we behave as we believe, which took me down that rabbit hole and why we've even met in the first place. I've been obsessed with belief for about 5 years now. Well, it got worse when I wrote my research paper because I'm like, well, I've got to either support or discredit my hypotheses. And is it true that the human belief system has more of a negative impact? And I said, well, I need to know more about belief. And wow, I'll tell you, that's a big topic. So
it's a large area.
Yeah. Oh my God, it's huge. And the fact that we've been able to cover a lot of the ground that we have in an hour is pretty impressive, but it's still the tip of the iceberg, when it comes to this. I just think there's so many mechanics to it, but I really feel like we together did a great job in educating the viewers a little bit more about why they think and feel the way that they do, and how that can have an impact on not just dogs, but like you brought up with Clever Hans and some of that other stuff. So in closing, Dr. Lack, I really want to thank you so much for your time. Is there anything else that you think our viewers need to be aware of or understand?
I think the big thing is I would encourage all of your viewers to start thinking about their own beliefs, right? And just really starting to engage in some of what we call metacognition, right? So thinking about my own thoughts. Why am I thinking that? Why did I respond that way? Instead of just doing it. Because when you start reflecting on that, that gives you a chance to then start putting those things to the test, right? And to start looking for information out there that will show, well, is this accurate or not?
Great. Thank you so much. And one of the questions I had for Dr. Lack when we were doing the pre-interview was if you could recommend one of your books that could help people understand their belief system and some other things. And he recommended Why You Can't Trust Your Brain. And is that it?
Yeah. So the full title is very long, but it's Critical Thinking, Science, and Pseudoscience, Why You Can't Trust Your Brain.
Perfect. I'm going to put a link to Dr. Lack's book. I highly recommend that if you're a canine handler, if you're in the training industry, or just even a regular dog owner, I think that we've established a good fact or a good point that your dog is going to be affected the way you respond to your environment, which comes from your beliefs. So I recommend this book to absolutely everybody. I have not read it, but I will be buying it and reading it myself because I love this kind of stuff and I've really enjoyed this conversation, Dr. Lack. So look for that link below in the comments. I will have the direct link to the Amazon store where you can buy Dr. Lack's book. And again, if you're near a Barnes & Noble, you can also get it there. Now everything's on the internet, so I'm sure you could just Google Barnes & Noble and find Dr. Lack's book. And he's got 5 other books besides that one too. You have 6 books that you've written, correct?
Yeah, so far, yep.
Yeah. Now, if somebody wants to look at one of the 60 scientific articles that you've written, where would they go to get that? Are those for purchase anywhere? Are they available?
Yeah, you can just go to my website, caleblack.com. And there's an area that says research, and on there's links to all the different articles, book chapters, etc.
Excellent. Well, Dr. Leck, thank you so much for your time today. I'm really happy with all the knowledge that you brought to us. And I hope all my viewers, I hope you guys and gals have absolutely soaked this information in. Please take it to heart, because in the end, we're all on the same team and we're all trying to do the exact same thing. And that's to have efficient police working canine teams doing the job to the best of their ability. So thanks again, Dr. Leck. Appreciate it.
Yeah, thanks for having me on, Brian.
You're welcome. So for all you viewers out there, as always, stay safe, watch your six, and Semper Fi.